Now, this afternoon, we intend to put a spotlight on the health sector in this country. Of course, this is coming just a few days before a major conference on nursing in the country. And I'm joined by Winnie Shena. Her middle name is so hard, I can't say it on TV. She is from the National Nurses Association of Kenya. Winnie, karibu sana.
Thank you. Thank you.
Before we get to even the conference that is coming, Winnie, in the recent past, the nursing profession has come under serious criticism. I almost said attack. But then where did we get it wrong as far as nursing in the country goes?
I think when we left out the nursing fraternity in planning for healthcare,
right,
that's where we got it wrong. Because when you look at in the country, we have free maternity service.
Right.
The maternity units are packed with mothers, yet we still remain with the same number of workforce.
Right.
So that actually builds up stress and emotions that people are not able to deal with.
Right.
So when we leave out the nursing in workforce planning, health policies, that's where we get it wrong.
So Winnie, you're saying that the projects by the government and the expansion was good, but they didn't incorporate the factor of the people who will be doing this job in that particular expansion.
Exactly.
Right. You've also mentioned that part of the conference, what you do is try to, it's some form of peer encouragement in terms of innovation and building your profession. Tell me about that.
What we do is that as an association, we want to build capacity for our members. And our members come from both the public, the private, and the education sector. And therefore, we encourage our members to do operational research that comes up with innovations and strategies to deal with different challenges at the health sector. And therefore, we create a forum where they can come, present the papers, be challenged, share information, you know, give us updates on what is happening, and even get peer review from members.
Right.
Yeah.
So when you talk about this presentation, where does it end? I mean, do we see some of these papers actually actualized and you know, implemented?
Yes, we do. Some actually get implemented, some not. Because we have challenges as any other sector. Because of, in terms of capacity, resources, we're not able to implement.
Winnie, shouldn't this be a role of the academic institutions who are actually training these nurses in the first place?
They have their role, but as a professional association, we also have a mandate that we need to develop the profession.
Right.
And part of development of the profession is to ensure we have research to produce evidence-based practice,
right,
and to ensure our members are updated with the latest evidence, you know, innovations and strategies for quality healthcare.
Earlier on, you mentioned that nurses were not involved in the planning of government projects in regards to health sector. Is this an avenue where the government can jump in, and how much is the involvement as it stands now?
It's an avenue, it's a window of opportunity,
right,
that you actually involve the people who are going to do the work in the first place to plan how best can it be delivered. When you're talking about access, it's not just the number of women or men who come to the hospital, it's how that hospital can also go to them. People don't have to come to us, we can actually go to them. Yeah, skilled delivery is not about giving birth in a hospital. You can be conducted delivery by a skilled person outside the environment of a hospital.
Right.
So we can look at many other avenues that actually conclude to access,
right,
not just making it free.
All right.
Yes.
Talking of access, let's bring in the money issue. And we do know right now, despite the many efforts done by the government in trying to make healthcare accessible to people, there are serious hurdles on the way. As a nursing association, what would be your proposal in the immediate term in regards to this?
I think they just need to employ people.
Is it as simple as that?
Yes. Employ nurses. Like I said, skilled personnel is not about coming to the hospital. You can call me to your house and I can come and give you care wherever you are.
Right.
If a mother cannot, like for example, when you talk about access, WHO standard is 5 kilometers. But really, have we attained that as a country?
Right.
We have made it free, but how many can get there? You need a taxi, you need form of transportation from your house to that place so that you can get it for free.
Right.
But if I can't come to you, then what's the problem? There will not be a challenge.
Right. Winnie, of course, we're coming at a time where the government has made a lot of adjustments in the budgeting. What are other achievables that can be done? And if you're to look in the region, say Uganda, Tanzania, Kenya, and our neighbors who've done this before, who can we learn from, and what other thing, other than employment, what else can the government do to increase accessibility?
Actually, is partnering with the private sector, because 48% of health services actually is being rendered by the private sector. How do we partner? How do we bring them on board as equal partners in delivering of care? We only assume that when you talk about government, it's public.
Right.
But that perspective needs to change. We need to look at private sector. We need also to look at insurance, health insurance.
Right.
How do we make it easily accessible, affordable for each and every person to be able to access it, so that they can support us in creating infrastructure for our members, or even for families and communities to access health services.
Right.
Yeah.
There is also a bit of frustration. Nurses have been accused of negligence. What do you say to that?
Well, we are not all 100% pure and innocent.
What do you do to the other people that, you know, bring shame to your
As a
profession?
professional association, we have a code of ethics and conduct. And for a person to call themselves a professional, then they ought to have innate ability to have discipline and regulation of yourself, per se, in terms of the way you conduct yourself.
Okay.
So we actually try and sensitize and empower members to have that ability to do the right thing at the right time. We promote professionalism by all means and condemn all forms of negligence. Yes.
You've just spoken there like government, but finally, free chance to make an ad.
Yeah.
What do we expect from the conference? What would be the outcome? What can the government draw from this?
Well, we expect nurses to attend, we expect government dignitaries to attend, we expect the private sector to attend, and what we are saying that we aim to achieve quality healthcare and efficient service delivery as envisioned in the Constitution.
Right.
And the Vision 2030. So we are saying we are equal partners, and if we can always partner and be consulted, then we can bring a lot of innovation on the table that can improve care in this country.
All right.
Yeah.
Winnie Shena, National Nurses Association of Kenya, many thanks for coming to the news desk.